Hello, senior citizen. Let's have an honest conversation, man to man. If you're over 60 and still masturbating, that's not a problem by itself. In fact, it can be part of a healthy routine. But the way many older men go about it can quietly harm their health without them even realizing it. This isn't about judgment, it's about awareness. Your body at 60 is not the same as it was at 30. Skin gets thinner, blood flow changes, the prostate becomes more sensitive. Even how your nervous system responds to touch and stimulation is different. Ignoring these shifts can cause real problems, some physical, some emotional. For example, using too much pressure or doing it the same rushed way you did when you were younger might cause nerve damage over time. Relying on porn every day can mess with your brain chemistry and lower your natural desire for connection. And sometimes a drop in interest or sensation is not just getting older, but a sign of something deeper like low testosterone or poor circulation. That's why I want you to watch this video all the way through. We're going to break down 7 common mistakes men over 60 make when it comes to masturbation. These aren't random tips. These are important truths that could protect your long-term health, pleasure, and peace of mind. Give yourself the chance to understand your body better. You've earned that much. Let's get into it. Number 1, masturbating without checking blood pressure stability. Let me ask you something most people are too embarrassed to bring up. Do you ever check your blood pressure before sex or even before you masturbate? Probably not. Most men don't. But at your age, it's something you should be thinking about, especially if you're on blood pressure medication or have a heart condition. Now, I know how this sounds. Masturbation seems simple, right? No stress, no partner to please, just a private moment. But here's what most men don't realize. Even solo pleasure can cause your heart rate to spike. During climax, your body goes through a rush of adrenaline, increased blood flow, muscle tension, and a rapid rise in pressure, all in a matter of seconds. For a healthy heart, that's usually fine. But for someone who already has high blood pressure or who takes medication that affects circulation, that sudden spike could lead to dizziness, chest pain, or in serious cases, a stroke or heart attack. I had a patient in his mid-60s who passed out in the bathroom right after climax. He thought it was dehydration. Turns out his blood pressure had jumped so high during orgasm that he blacked out. He was lucky. It could have been much worse. So here's what I tell my patients. Know your numbers. If you have a home blood pressure monitor, use it regularly. Keep track of how you feel before and after sexual activity. If you feel lightheaded, short of breath, or get heart palpitations afterward, that is not normal. And it is not something to ignore. You are not weak for being cautious. You are smart for knowing your limits. Pleasure should never come at the cost of your safety. So enjoy your body, but do it wisely. Check in with yourself, because the goal is not just to feel good in the moment, but to stay healthy enough to keep feeling good for years to come. Number 2, forcing erections with aggressive techniques or devices. Let's talk openly. I know the pressure many older men feel to perform or stay sexually active as they age. It is natural to want to feel like yourself, to feel like a man. But here is the truth that many are afraid to admit. Forcing an erection is not the same as restoring one. I see more and more older men turning to aggressive methods to make things work. Tight grips, intense stroking, vacuum pumps, tension rings, even DIY devices they read about online. I get it. When things are not happening as easily as they used to, frustration kicks in. You want results, you want control. But sometimes, in chasing an erection, you end up doing more harm than good. Your penis is not just muscle. It is filled with delicate blood vessels and nerves. If you use too much pressure, whether with your hand or a device, you can damage those tissues. I have seen cases where men end up with nerve pain, bruising, or even numbness that does not go away. In serious cases, it can lead to scarring or erectile dysfunction that becomes permanent. One man in his 70s came in with what he thought was just soreness after using a vacuum pump too aggressively. It turned out he had ruptured small blood vessels, and now he struggles to maintain sensation. Here is what I want you to understand. An erection should be natural, not forced. It is not a battle. And using pain or pressure to prove your virility is a sign that something deeper needs attention, whether it is circulation, hormones, or mental health. If things are not working like they used to, talk to a doctor. There are safe, medically sound options out there. Do not hurt yourself trying to feel young again. Real strength is in knowing when to get help, not in pushing your body past its limits. You deserve pleasure, but you also deserve protection. Number 3, neglecting prostate health while focusing on pleasure. Let's talk about something most men avoid until it is too late, the prostate. I get it. When you are in the moment, focused on pleasure, the last thing on your mind is your prostate. But the truth is, that little gland deserves a lot more attention than it gets, especially after 60. The prostate sits just below the bladder and surrounds part of the urethra. It plays a big role in sexual function and fluid production. But here's the problem. When it starts acting up, most men either ignore it or assume it is nothing. That is a mistake. If you ever feel pain during orgasm, pressure in the lower back or groin, or notice it takes longer to urinate, or you have to go more often at night, do not brush it off. These could be early signs of prostatitis, which is inflammation of the prostate. It could also be benign prostate enlargement, which affects millions of men. In some cases, and this is the one you really cannot ignore, it could be an early sign of prostate cancer. I had a patient in his late 60s who mentioned almost casually that he had some discomfort after climax. He thought maybe he had just pulled a muscle. We ran a few tests. Turned out he had early-stage prostate cancer. We caught it just in time. You see, pleasure is great, it is healthy, but if something feels off, any pain, unusual pressure, burning, or even just a sense that something is not quite right, your body is talking to you. Do not silence it just because you do not want to deal with it. Getting a regular prostate exam may not sound fun, but it can save your sex life and your life, period. You are not weak for getting checked. You are smart, you are responsible. So enjoy your body, but respect it too. Pay attention, because pleasure means a lot more when you are around to enjoy it for years to come. Number 4, using outdated or dangerous lubricants. Certainly. Here's a 350-word elaboration on the point, using outdated or dangerous lubricants, written in simple, relatable language with a warm, honest, doctor-to-patient tone that keeps the audience fully engaged. Let me tell you something most men never think about. The stuff you use down there matters just as much as what you do with it. I am talking about lubricant. You might laugh, but I've seen more issues caused by old-school products than you can imagine. Many men over 60 still reach for whatever is lying around, the old petroleum jelly, baby oil, body lotion, even cooking oil in some cases. I get it, it is what you're used to. It worked fine when you were younger, right? But your skin was different then, your body was different. As you age, the skin around your genitals gets thinner and more sensitive. That means ingredients that were harmless before can now cause problems. Petroleum jelly, for example, can trap bacteria in tiny cracks in the skin. That can lead to irritation, itching, or even infections. Scented lotions and artificial chemicals can throw off your skin's natural balance and leave you dealing with redness or discomfort for days. One of my patients in his 70s came in complaining about a rash that would not go away. Turned out he was using an old aftershave as lube. He figured if it felt cool and smooth, it must be fine. What he did not realize was that the alcohol in it was tearing up his skin every single time. Here is the truth. The older you get, the more your body demands quality over convenience. You would not put motor oil in a classic car's engine, would you? Same idea. Choose lubricants that are water-based or labeled for sensitive skin. Look for ingredients you can actually pronounce. If your skin burns, stings, or stays irritated after using something, stop. That is your body saying no. Taking care of your pleasure also means protecting the skin and tissue that make it possible. You deserve comfort, not damage. So do it right and give your body the care it's earned. Number 5, ignoring decreased sensitivity as just old age. Let's talk about something most men do not bring up until it starts affecting their confidence. That feeling down there just is not the same anymore. Maybe it takes longer to feel aroused. Maybe orgasms feel dull. Maybe the whole area just feels a little disconnected. Now here is what I want you to not do. Do not chalk it up to just getting old. Yes, some changes are natural with age, but a numb or less sensitive penis is often your body waving a red flag, not just flipping the aging switch. Let me explain. Sensitivity in that area depends on blood flow and nerve function. So if sensation starts to fade, it could be your circulation slowing down. That means your arteries might be narrowing. That could be the early whisper of heart disease. Or maybe it is nerve damage. Tiny nerves in the penis can be affected by long-term diabetes, even if you do not know you have it yet. I've seen patients come in for sexual issues and walk out with a diabetes diagnosis they never expected. Another possibility? Certain medications for blood pressure, cholesterol, or even depression can cause these changes. So can alcohol, smoking, or sitting too much without moving your body. I once had a patient in his late 60s who thought he was just numbing out with age. We ran some tests. Turns out his blood sugar was way off the charts and he had no idea. That numbness, it was the early sign that saved his life. So listen, your penis is not just about sex. It is part of your health system. It is trying to talk to you. Ignoring decreased sensitivity is like ignoring chest tightness and saying it is just indigestion. Do not brush it off. Pay attention. Get checked. Catching the cause early could mean a longer, healthier life, not just better sex. Number 6, assuming libido loss is normal and not investigating. Let me be very honest with you. Losing your sex drive is not just part of getting old. It may be common, yes, but that does not mean it is normal. And it certainly does not mean it should be ignored. I cannot count how many men over 60 come into my office and casually say, "Doc, I guess I'm just past that part of life now." They say it like it is no big deal. But when I ask a few more questions, the truth comes out. They feel disconnected, emotionally flat, sometimes even ashamed. But instead of investigating it, they simply accept it as their new normal. That is a mistake. A vanishing sex drive is often your body's way of waving a flag. It could be low testosterone, it could be depression, it could be thyroid problems or the side effects of a medication you've been taking for blood pressure or cholesterol. One of my patients in his late 60s came in complaining of low energy and zero interest in intimacy. He assumed it was just aging. We ran a blood test. His testosterone levels were half of where they should have been. With proper treatment, his mood improved, his confidence came back, and yes, his sex drive returned. Libido is not just about sex. It is tied to your energy, your motivation, even your sense of purpose. When it fades, it is worth asking why. If you suddenly stop craving touch or connection, or you feel like the desire is just gone, do not brush it off. Talk to a doctor, get blood work done, check your hormone levels. Review your medications. You are not too old to care about this. You are just wise enough now to ask the right questions. Pleasure, connection, and desire are not reserved for the young. They are part of your health, and they are worth fighting for. And number 7, treating it like a dirty habit instead of a health signal. Let's clear the air. Masturbation is not dirty, it's not shameful, and it's certainly not something you need to feel guilty about at your age, or any age. But here's where it gets tricky. When a man starts using it as a way to escape rather than understand what his body or mind is really telling him, it stops being helpful and starts being harmful. I've had older patients come in and whisper like they're confessing a crime. They say things like, "Doc, I still do it now and then," as if they expect judgment. But what I always ask next is this: why? Is it out of natural desire, or is it to silence something deeper? Sometimes it's loneliness. You live alone. Maybe your partner passed away. You miss touch. So you reach for release to feel something, anything. That's understandable. But if it becomes your only way of coping, you're not addressing the root issue. Other times, it's used to mask anxiety, stress, or even the fear of not being a man anymore. Maybe you're avoiding intimacy with a partner because you're struggling with erectile dysfunction. Instead of seeking help, you go solo and convince yourself it's just easier that way. But that's like putting a Band-Aid on a deeper wound. The problem doesn't go away, it just hides for a while. Your body is speaking. If you feel numb, or if climax feels unsatisfying, or if your drive suddenly vanishes, that's a signal, not a punishment. Your sexual health is deeply tied to your mental, emotional, and physical health. So don't treat masturbation like a secret sin. Treat it like a check-in, a pulse check on your well-being. Ask yourself what's really going on before and after. That self-awareness can be the start of real healing and even greater satisfaction. This isn't about shame. It's about paying attention. You deserve that kind of care. Number 8, clinging to youthful performance standards. Let's have a real conversation. One of the biggest silent struggles I see in men over 60 is this. They keep comparing themselves to the man they were at 25. The energy, the stamina, the erections on command, the back-to-back rounds, all of it. And when their current body cannot keep up, they feel like they are failing. That thinking is not only unfair, it is harmful. You are not the same man you were in your 20s, and you should not be. Chasing that old version of yourself can actually rob you of the pleasure, peace, and connection available to you now. I had a man in his early 70s sit across from me in tears. He was in good health, but he could not finish like he used to. He was ashamed, frustrated, and scared. When we talked more, it became clear that nothing was wrong with his body. The problem was in his expectations. He was measuring success by a standard that did not fit his life anymore. Trying to force your body to behave like it did 40 years ago only builds pressure, and pressure kills pleasure. It turns intimacy into a performance, not an experience. The truth is, your body now has a different kind of wisdom. Maybe you take longer to get aroused. Maybe you prefer touch over thrust. Maybe your desire is deeper, more emotional than before. That is not a weakness, that is evolution. Sex after 60 is not about proving anything. It is about presence. It is about connection. It is about enjoying how your body feels now, not resenting it for not being 25 again. So take the pressure off. Let go of the stopwatch. Stop trying to outdo your past and start listening to what your body wants to teach you now. You've not lost anything. You are just in a new chapter, and it is worth exploring. Number 9. Masturbating in isolation as a way to avoid intimacy. Let's be honest, masturbation is normal, it's healthy, it's private. But the real question is why you're doing it and what it might be replacing. A lot of older men use masturbation as a safe space. No pressure, no rejection, no awkward conversations or emotional vulnerability, and after years of life, heartbreak, or maybe even divorce or loss, I completely understand why that kind of control can feel comforting. But here's the truth I need you to hear. When masturbation becomes a substitute for connection rather than a part of a balanced life, it slowly chips away at your emotional strength. I've seen it happen. A man in his late 60s told me he had not been on a date in over 10 years. "What's the point?" he said. "I can take care of it myself." What he did not realize was that his isolation was not protecting him. It was slowly eroding his confidence and his capacity for real closeness. The longer you stay in that solo bubble, the harder it becomes to reach out. The less comfortable you feel with touch, with conversation, with sharing your true self, it becomes easier to retreat than to risk. But the price of that comfort is loneliness. Masturbation should be part of a healthy relationship with your body, not a wall that keeps others out. Because even after 60, you still need warmth. You still need connection. You still need laughter, affection, awkward first kisses, and the joy of being seen. Do not let solo pleasure become a hiding place. Step out. Practice being close again. Call someone. Flirt badly. Ask questions. Let touch be more than just physical. Your life is not over, and neither is your ability to love or be loved. Pleasure alone is fine, but connection is where you truly feel alive. In final words. Of course, here's a strong, grounded, and relatable conclusion for the topic: 7 masturbation mistakes after 60 that are silently harming older men. Written in plain, thoughtful language, like a caring doctor giving final advice to a patient. Let me leave you with something important. Masturbation is not the problem. The problem is what gets ignored around it: your health, your emotional well-being, and the silent signals your body may already be sending. By the time a man reaches his 60s, he has seen and lived through enough to deserve peace, pleasure, and clarity. But those things do not just come with age. They come with awareness. That means paying attention to changes, asking the uncomfortable questions, and not brushing off things that feel off just because you think they are part of getting older. I've seen too many older men ignore warning signs: reduced sensitivity, pain during orgasm, low libido, blood pressure spikes, and tell themselves, it's just age. But sometimes it is not. Sometimes it is your heart, your hormones, your prostate, or even your mental health asking for attention. And when men keep these things to themselves, they often feel isolated, quietly frustrated, sometimes ashamed. That's not how this chapter of your life is meant to feel. You still have every right to enjoy your body, to feel desire, to feel pleasure, but you also owe it to yourself to do it in a way that is safe, informed, and respectful of the changes happening inside you. That's why I encourage you to watch this video through to the end. Every point we cover here is designed to help you take better care of yourself. Not just physically, but emotionally and mentally too. It is not about judgment. It is about awareness. It is about giving you tools to enjoy this part of your life with confidence and wisdom. So take a few minutes, listen closely, and ask yourself what your body might be trying to say. You are not done growing. You are just learning to listen better. Thank you for watching, and don't forget to subscribe. See you in our next exploration.